Welcome. You're watching Let's Talk Healthy Pets. This is the January edition, and I'm Dr. Ed Sulkowski, your host. And today our topic is going to be chiropractic care for animals, and I'd like to welcome my friend Dr. Jonas Marry. Jonas, welcome to Let's Talk Healthy Pets.
Thank you, Ed.
And we have Abby over here, and Abby's going to be our little guinea pig today.
Perfect.
Well, I wouldn't call her that. She's
No,
going to be our little patient today. And our topic is going to be about aspects of chiropractic care for animals. We're going to focus on dogs. But Dr. Marry is certified as well to do horses and rabbits
Cats,
if need be.
Guinea pigs, we've adjusted them all.
Adjusted them all.
Adjusted them all.
Jonas, tell us a little bit about your background and why you became a chiropractor, where you went to school.
You know what? I was really looking into what part of the health field I wanted to go into, and the two major divisions for me were going to be chiropractic or medicine. I have to say that the biggest influence was my training in the martial arts. The philosophy of the martial arts is such that you view the person as a whole. The training is not just about a destructive end result, but really refining yourself in the process. And when I looked at the philosophies of medicine and chiropractic, chiropractic more paralleled that same philosophy of wholeness and approaching that person in not only a state of reverence, but looking at them from not just their physical standpoint, but their lifestyle and their belief system and so on. And it made the transition very easy.
And if I recall, because Dr. Marry is my personal chiropractor as well as a chiropractor to my dogs.
True.
But you went to Palmer Chiropractic?
I went to Parker, actually.
Parker, okay.
Palmer was the original school in Iowa. And when I looked at the two there, I can't tell you I have any great wisdom as far as decisions went, because I looked at Palmer and thought, they get about 10 feet of snow every winter.
I was going to say, and you went to Texas where it was warm.
And Parker gets a little bit of, they're in Dallas, so they get a lot of heat. But I got to tell you, I love snow, and I'm missing it. And Texas cured me of the heat, because 100+ degrees most of the year, 7-8 months out of the year.
We have this discussion all the time. He likes the snow, and I like it 80 degrees or 85. So when it snows, he's happy. When it's warm, I'm happy.
You got it. So I'm missing the snow. Yeah.
But so you came back, and you are a resident of Peters Township, and your office is also located in Peters Township.
Yeah, I'm right in Pella Plaza, just down the road from here, really.
Off of Route 19.
Yeah, and I started really looking at animals when my daughter started riding horses. Horses, my initial thought were big dogs, and they're not. They're not by any means. You really got to know what you're doing around horses, and it's a different approach, and they're not just large pets. So the thing I really wanted to take a look at if she was going to be riding these big animals, because she was 5 at the time, was that they were healthy. As I started talking to some of the people in the equine field, I started to get an understanding that horses go through a lot. They have a lot of injuries. They're not as easy to treat sometimes, because you can't just bring a horse in and do an x-ray. And because they're such large animals, how they get treated is a little different than how we would even address the small animals, the dogs, the cats, and so on. And I also found out that very often they get stress fractures across their withers or their shoulders that go unnoticed. And it puts them sometimes in a little bit of a cranky mood. And I thought, I'm a little concerned with my 5-year-old out there on that great big horse, and what if she falls off? The beauty there is I get to adjust her, and that's fine. I know she'll be okay. But I thought, if we can make the horse as comfortable as possible as well, then everybody wins. Mm-hmm. And she happens to ride at a barn with a lady who's fantastic. And we got to talking about it, and she said, yeah, it is pretty common. We get horses that get stiff a lot, and they don't move well. And as you're trying to teach a student to change their lead or bring a horse in a certain direction, if that horse is sore, it's tough to do, and sometimes they resist. So I thought, I got to do this. And Dr. Bill Inman, who happens to be a vet, was dating a woman who was a chiropractor at the time. And it's kind of funny. They started exchanging information, and almost 25 years later now, the VOM procedure was developed, and that's VOM is veterinary orthopedic manipulation. And what it does is it allows you to use just a very basic instrument that we'll see in a little bit to not only evaluate that animal, but to adjust them. And it's extremely low force. No animal has ever been injured using it. And it allows us to be objective in our approach, because animals have certain reads in their spine that we don't. And it's almost like a reflex. So when you're evaluating that spine, they've either got a subluxation or they don't.
What do you mean by reads?
A read is a reflex that when you put a force into an animal's spine, any of our 4-legged mammals, when you put a low force into an animal's spine like you would with any adjustment, they don't have a nerve that we have. And because they don't have that nerve, they will respond differently than we would. And so what will happen is you get a twitch response. And it's called the panniculus reflex, is the great big long name of it. But it causes a twitch response at that level. If it's a healthy joint, when you put that low force in there, you just absorb it and you move on like we do all day. If you step off a curb or miss a step or just walking or doing anything, there's forces always being transmitted through the body. If we're well, we absorb them and continue on. But if you've got an area that's not working right, then in them, we'll see a twitch response. So it's very, very simple to see that panniculus reflex or that panniculus response and say, yeah, there's an area that's injured that we need to look at more closely, or they're great. I've gone down animal spines before and checked every single level, and they're as healthy as anybody else is. And we don't do anything at that point.
You know, the medical profession is an interesting business. And what I think that has happened, for whatever reason, is we've compartmented it. You go to a dentist, he's a head and neck specialist, or even focuses more even so on the mouth. You go to a kidney specialist, you go to a heart specialist, you go to a podiatrist for your feet, you know.
Right.
And everybody looks at the body, whether that be the human body or an animal's body,
right,
as pieces.
Exactly.
And it's not, we're not pieces. We may be made up of pieces, but there's a total being here that's a combination of all these pieces. And chiropractic care, I think, is the only medical profession that I'm aware of that really looks at the body as a total being and treats it that way.
I agree, and the beauty of that it's fortunate in that regard, in the fact that we do get to look at the whole person, and because you do, you're able to come up with perhaps a plan of action that would differ slightly, rather than saying let's get rid of this symptom or that, because we really don't want to treat symptoms. In doing that, we lose that body's indicator that says, hey, something's going on here. Given the opportunity to look at the body as a whole and say, well, why is that symptom present? What stresses are going on in the body? Or how's the body responding or not able to respond that's showing us this?
Well, I even think your education in nutrition is paramount with your profession. You go, I've had my own experiences with nutritionists, MDs that have PhDs in nutrition and know little about what the body needs for wellness. They know the government standard pyramid, or they know the standard American diet, which is SAD, and it is sad.
Yes.
You know, and they expect you to heal. And your body's designed to heal by itself if you give it the proper proteins and nutrients.
Yes.
And I think most chiropractors sell their own or offer their own supplements in there, know about protein and absorption and so forth.
Right.
And it's rare in all these other fields of medicine.
Well, when you mention protein, especially the stomach, you got to have certain amounts of acid to absorb certain nutrients. One of the things that I see really often in people, but I'm starting to see commercials for this for dogs. All over the place, not just the Prozac that's now just been approved for dogs, but other supplements that are out there all over the place. But people very often are being given something to reduce the stomach acid because they have reflux or something else. Go ahead. What do you? Because I see something.
Well, it's just so comical, and it's not comical. I say that flippantly, but I don't mean it that way because I've gone through this experience myself.
Right.
You need stomach acid to break down the proteins for you to absorb them. You need stomach acid to break down calcium. You could be on 1,000 milligrams a day of calcium, and you get none of it because its acid needs to break it down. Right. So you see people be given, we're diverting a little bit from our main purpose here, but I think it's important for the audience to hear this. You give somebody Nexium or some antacid, which stops the production of acid in the stomach, and so then they start having other problems with their overall health because they don't have the nutrition that they need.
You got it.
And then they start developing osteoporosis because they're not absorbing the calcium, the magnesium, the phosphorus, the boron, the B12, you know, and then it kills all the good bacteria, and there's less absorption and no vitamins being made.
It's a vicious cycle.
And you sit there and you watch deterioration happens, and it's true. It was a human being situation. Now it's an animal situation as well, and they're giving Nexium to animals. They're giving Nexium to babies.
They are.
You know, and why we're doing this, you know, I can't go there now, but
we're taking a paradigm and applying it to a whole different species that may or may not work well for them.
And we did that with food, and look at the health problems we have with the poor quality of food.
I
agree. Know, so when you commented, of course, on Abby, and you saw Abby, and I don't know if we can see Abby here on camera here. She glistens.
She has a great coat.
And she's soft.
Yeah.
And that's a sign of inside health.
You got it.
And the reason that is because she's being fed
what
proper
she needs.
Protein.
Yeah.
You know, not corn, not wheat, not byproducts, not meals. She's eating what I can eat.
Right.
And actually organic stuff is what she's eating.
Right.
And it reflects in her overall health and reflects in how she looks.
It does.
And she's given vitamins and minerals and antioxidants.
Yeah.
You know, in the form of my longevity formula. And
it's crucial to them being able to repair.
absolutely.
Regardless of whether we are talking about people or animals or anybody else. The first thing I tell people is, listen, here's what we're going to do. There has to be communication in the spine in order for there to be any change in the body. If the nervous system can't communicate to the tissue or the cell level, how can you expect a change? But even once that happens, if we're not going to bring the necessary nutrients on board for you to repair with, I would never say to you, here's the blueprints for a house, and here's a hammer and nails, but give you no wood. You'd never get a house out of that. So you got to have those nutrients in place in order for them to really be able to heal and grow. And one of the most common questions I get is, I find that my dog is eating its own feces. What do I do? And the thing that I learned when we were studying that is they're not absorbing their nutrients, or they've got a food that isn't. So how would you approach that?
Well, way that my studies in this, and I studied this extensively, there's no definitive reason why they do that. Dogs don't absorb well, and so sometimes that food coming out is appetizing to them because it still has that smell, which is basically what attracts them to it. Sometimes it's because they don't have the proper bacteria in their intestinal tract, and they're going to find that bacteria in the feces. Sometimes it is because I had dogs that I've rescued that had emotional problems, so they weren't fed, and they were kept in a cage, not fed, and what they had to eat was their own feces.
Was left.
And it took a while to break them of that habit, So, but a lot of it is the inability for them to absorb, or the food going in doesn't have the right protein. And if we eat a carbohydrate, we're hungry an hour later.
Right.
If we eat a protein, our body is satisfied because it received what it needed, and we're not hungry an hour later. And it's the same thing with these dogs. If they're not being fed the proper protein, especially if some of these foods that are corn-based and wheat-based, they're not satisfied, and this smelly thing comes out, and they go, gee, I think I'll have lunch again, you know? And
well, and you mentioned really two good points there. One being the adequate bacteria, because boy, is that a common thing in people and animals. We don't have the right gut flora.
We can help at it with stopping things to kill it and probiotics.
See, and the beauty of that is, very often people will say to me, well, what should I take? And there are absolutely probiotics that you should take and that work effectively, but if you stop killing it all the time, then, and see, now we're back to that different paradigm of looking at the whole person. Yes, we can just keep putting it back, but why are you destroying it in the first place? What is it that's going on in your life or lifestyle that's having that effect? And I gotta say, even though we're talking about the compartmentalization of health or medicine in general, for any animal to be adjusted in our state, the vets have to okay it.
I was just going to bring that topic up. I have a dog that needs adjusted. How do I call up Dr. Mary's office at Family First Chiropractic and say, Abby's coming in, what time?
You do that, and then the very next thing that the receptionist is going to say, that's fantastic, have you got the vet's approval yet?
All right, so for a vet's approval, you need a script or a phone call or what?
It can be verbal, or they can fax it, but what we're really looking for is, and the significance of this is that animal is going to be treated in the best way possible, meaning there's no fracture, there's no infection, there's no cancer present or history of. Because if there is, especially if it's in the spine, because none of those would stop me from doing an adjustment, and before the vets get too excited about that, it's not that would stop me from doing the adjustment, but I would want to know, is that going on, where is it going on, and to what extent? If they feel that it's okay, then we're still going to adjust. We're just not going to adjust those areas that are affected. But the crucial part about that is, and I don't have any research on this in animals, but it is absolutely a fact in humans, every time you get adjusted, there's a 30% increase in immune function. So when you're talking about an infection or a fracture or even cancer, your immune system is on top of things.
An immune system is key.
It is absolutely essential.
I'm not knocking by any means the chiropractic profession. I'm a firm believer in it, as you well know.
Right.
I utilize your services all the time. And I'll tell people, they're having issues with their dogs, and I'll say, well, in that case, I would get a chiropractic adjustment. Call your vet. Dr. Marry does it. There's Dr. Whitman in Finleyville does it as well.
Yeah, there are vets and chiropractors that are doing this all over.
Yeah, and not every chiropractor is certified to treat animals. And people say, oh, I don't believe in that. And I'll explain to them, our dogs' bodies, are nothing but tubes. Right. It's just a central tube with outsprouts.
Yep.
And I'll explain to them, I'll use this analogy. If you have a garden hose and you kink your garden hose, the water doesn't flow.
Right.
Well, we're nothing more than water and electrical energy.
Right.
And if we're kinked, we don't flow. And I'll tell the audience a disgusting little story.
It's true, though.
As the audience knows, they've heard my story from time to time. I've had, I have this issue with intestinal blockages because of the situation I went through. And there was one time I walked into your office for a treatment, for an adjustment, and you right away said, "You're having a problem." I said, "Oh yeah." And you said, "Well, I'm going to adjust you and do something a little different, and then I want you to come back in 4 hours for another adjustment." And I said, I came back, and I think I was crawling into your place because I was having a bad problem. And you said, "No, you're going to open up pretty good." Well, you adjusted me, and within an hour or two later, I opened up and cleared out. And you actually alleviated what could have been a potential life-threatening situation for me. So does chiropractic care work? Absolutely.
Right. I think it's as simple as what you said. It's the understanding that most people don't really understand their own bodies very well, and because we've been so inundated with treat the symptom, sometimes it takes a little time, or the other part of that is just understanding that communication is critical to this process. So if the nervous system can't communicate to the body, or vice versa, because it is a two-way street, then really there are going to be changes. And people say to me all the time, "How did you know that was there?" There's no magic to it. There's different parts of the spine that control different parts of our physiology, and when you see that injury in that area, you know probably something's going on there.
And that's part of the reason acupuncture works, because
that's exactly right.
It's stimulating those nerve centers.
Yes.
And it's causing these pulses to flow, to actually be aggravated a little bit,
right,
to settle down a little bit, to come back to normal.
Yeah.
And that's basically what you do with an adjustment.
That is exactly what happens. We're seeking to not fix anything, but allow for greater communication so the body can become more aware of any deficiencies or anything that's in excess and begin to make those changes on its own, because your body heals itself.
Okay, and it does, as long as we support it.
Yes.
So just to step back a little bit, I know there's an issue with my dog, and I suspect that maybe a chiropractic adjustment would be wonderful.
Right.
So I call my vet, or take my dog to my vet, and then I get the permission slip. Then I call your office, and then you make an appointment. Are there certain times that you see the animals?
There absolutely are. We try and do them around lunchtime or at the end of the day, so that there's only animals in there. That way we're not stressing out the animal, or the people for that matter, so that they each can be comfortable in that environment, because that makes a big difference.
Okay.
So yes, there are.
And the number of times that I would bring my dog in for adjustment depends on the response that you see after the adjustment?
Absolutely. Absolutely. We're looking usually at a week's time in between, depending on how seriously involved whatever it is that's going on comes through the door. But generally we like to give a week in between, and then the number of visits is going to be dependent upon those first few adjustments, and we see how's it they're responding.
Have you had some veterinarians that don't agree with chiropractic adjustment?
I've only really met one. I got to say, the veterinarians in our area have been absolutely fantastic. They're on the ball as far as what's going on, and they couldn't be really more helpful. It's been very, very effective and very simple.
I'm glad to hear that.
You know what, I was too. They've been great to deal with. Absolutely fantastic.
Wonderful. And you're starting to be known around the area as the animal adjuster as well.
That's starting to occur, yes. It is.
Yeah, I was talking with somebody last night and knew right away of you.
Yeah.
You know.
Well, I think we're
not so much from your human chiropractic adjustments, but from the animal adjustments.
Yeah, true.
So that was kind of neat, I thought.
It is. It's true. It's changing.
So anyway, so I call and I make the appointment, and then you get the animal in as soon as possible.
Absolutely.
And my experience with you is you treat them just as though they were a human patient.
Absolutely. The name of the office is Family First Chiropractic, because it really is about a family level of care, and our pets are part of our family.
Absolutely.
Simple.
And thank God more and more people are thinking that way.
They are.
Because they are little human beings in there somewhere.
They are.
At least that's what I say. They all have different I have all those dogs, and they all have different personalities.
They're just like kids.
Ways of communicating and so forth. But anyway, so your office is on Route 19.
It is.
The address?
3150 Washington Road.
Okay.
Right in the Pella Plaza.
And so the steps are call the veterinarian?
Call the veterinarian first. Make sure they approve it. Once that's done, give us a call, and we'll evaluate the animal. If we find that something's chiropractically going on, we'll let you know. And if it isn't, then we make the appropriate referral back to the vet.
Does it help to bring x-rays in?
It absolutely helps to bring x-rays in.
We're going to be going to commercial break, and then we're going to be back with Dr. Marry and continuing the conversation on chiropractic care for animals.
You know, the greatest gift we can give our children is an education in character, Today's world isn't the same as it was when we grew up. Today, our children suffer great fear, trauma, and anxiety because violence has moved into the classrooms. There are reports of spontaneous shootings, violent disrespect towards authority, knife slashings, and bullying attitudes. Parents fear for their children's safety. All of this because some children have not been taught self-control, and many lack training that builds character. There is a solution. The Peaceful Solution Character Education Program, providing children with basic moral training. Call 1-888-613-9494. That number again, 1-888-613-9494.
Hello.
Hello, this is Danny Glover.
Danny Glover?
I'm giving a wake-up call to every man in America. Mr. Johnson, did you know that at every age, American men have poorer health and a higher risk of mortality than women? Men experience higher instances of death due to hypertension, cancer, stress, HIV, and depression. As a matter of fact, men live sicker and die sooner from all but one of the leading causes of death. We take more risks, handle stress differently, and are less likely to schedule checkups or to follow up when symptoms arise. If you really want to be a man and take care of your family, you can start by taking care of yourself with a doctor and find out what might go wrong before it does.
I'll call today. And thank you.
You're welcome. Bye. Hello, Mr. Rodriguez?
Welcome back. I'm Dr. Ed Sulkowski, and you're watching Let's Talk Healthy Pets. We're here with our guest today, Dr. Jonas Marry of Family First Chiropractic, and little Abby over here. And we left at commercial time talking about nutrition and the importance of nutrition with overall health and how it applies to healing and the immune system and so forth. And now we're going to talk something a little bit different. Dr. Marry was scheduled prior to be on the show at this time, but it just so happens that over Christmas, my little Tucker hurt his back on Christmas Day, and 2 days later kind of hurt it again and went paralyzed. Couldn't move his back legs and so forth. And I took him into his vet, and I had given him an injection overnight, an anti-inflammatory, and took him to his vet the next morning as her office opened. And I took him in with him sitting up and wagging his tail and kissing me. And his vet walked in, and I don't know what exactly transpired here, but she grabbed him. She went to place her hands on him and pressed, and really didn't assess the situation. And he immediately went, screamed, and went downhill from there. And I carried him home limp. We are treating him, going back to the same vet, and we're doing acupuncture, and we're doing some natural steroids and a number of other things, and he's responding. But what I've noticed the most is I immediately called Dr. Marry and took him there, and Dr. Marry's been adjusting Tucker. And right. Tucker is showing, I know he'll be walking again. He's gained his bladder control back, and he's moving his legs with force now, and he's a little scooter right now. But Dr. Marry has been adjusting him, and immediately after adjustments, I see improvement. In fact, the first adjustment, you noticed the improvement like immediately, and he was responding very quickly. So when I was there, and we're going to talk a little more detail about Tucker. Sure. You had told me a story about a Chihuahua that had been brought to the office. Yeah,
a lady had gotten my name. I actually don't remember where she had gotten my name from, but she had just been at the vet, and it was a Saturday, and I just happened to stop in the office. I had to get a little bit of work done, and answered the phone, and it was a woman who was incredibly distraught. She was at the vet's office, and the Chihuahua had gone paralyzed, and there was no apparent reason. It had been running around fine. She has several other dogs, and her assumption was that just through some rough play or maybe a fall, there had been an injury, but didn't have any clear understanding of what may have happened. So after the initial evaluation, there was the vet had said, it doesn't look like there's much we can do here. And this had been going on for about a week between she and the vet, back and forth, back and forth. There doesn't look like there's a lot we can do here. We really should put the Chihuahua down.
And the dog wasn't moving its back legs?
Was not moving its back legs at all. In fact, if you'd stand the dog up, she would just fall over to either side. She had no control, not only of her hindquarters, but she had no bowel or bladder function either. So the woman was really having to take care of this animal, almost like a newborn, between getting it outside to go to the bathroom and to help it go to the bathroom because she was helping to express the urine out of the bladder, and taking it everywhere because it couldn't even crawl forward using its front legs. It was a really small animal, but also very young. It was only maybe, I think, 2 years old at the time. So when she finally got a hold of me on that Saturday, I said, you know, as always, the vet is going to be the gatekeeper here. We have to make sure that she's safe to adjust and that we find out what's going on. And so got the vet on the phone. She couldn't have been nicer. She said, you know, I don't see a lot of improvement for this animal, but because her only other option right now is to put the dog down, go ahead and try it. You know, I have no problem with that, but, you know, keep it reasonable within a week or two if you're not seeing any change. And I said, no problem. We'll communicate if there's anything going on or any questions that I have or you have, please get back to me. So after about the second or third adjustment, we started to see a change. She started to actually be able to use her one leg.
And what do you mean by use the one leg?
She couldn't use either leg at all. In fact, when she laid down, her legs would just go out straight to the side, and half of her body would be going this way, and the rest of her would be sitting up like a dog would normally lay, but she was very stiff. So after that second or third adjustment, that right leg started to actually be able to be retracted back and put forward again. Not with really any force, but she was moving it actively. It wasn't just reflexive. And that's when I knew, I thought, you know, this dog has a chance. And it took probably 3 months total before we got to the point where she was walking again. But she walks no problem now. She does have some residual weakness in her left leg, but she uses that leg. She's able to run, and she's got an evenness to her hindquarters. She doesn't have a really big build-up right hip and no muscle tone on the left. She's very, very close as far as the symmetry of her muscles go. So she is using her left leg, and she's gotten bowel control back 100%, and bladder control is about 80%.
So she's able to retain her urine and expel it on her own?
Yeah, she has accidents now and then, but not anything like she was before.
Well, that was like even with Tucker. He's still not able to express it himself. I have to do that.
Right.
But the first few days, he was leaking all the time. I mean,
Right.
he would lie down and it would just come out on its own.
Right.
And now he is holding. He doesn't leak at all.
And I think we talked about it a little bit earlier in the beginning of the show that I think people don't realize that even the bladder has 3 muscles that line the wall of it, and they not only help to hold the urine in, but also to push it out. So those muscles, like every other muscle in your body, have to have nerve input to that area in order to function properly. In the case of the Chihuahua, the injury was in the low back, and those happen to be the nerve roots that come out and do go to the bladder and the bowel, as well as the rest of the lower extremities, just like they do in humans.
So when you say low back, you're saying lumbar region?
Yes, exactly. And so, you know, what I'm looking for whenever we do an assessment on any animal is, does the injury that you're describing or they're presenting with match the area where I found a change, if there is one, or there's a subluxation or a misalignment to a degree. If that's the case, then we have something that's consistent. We can say, yes, we see the injury. It's in the place where there's a problem in the nervous system. That makes sense. Let's follow up. If there isn't, then one of two things needs to be done. Either more testing needs to be done, or this potentially is not a chiropractic situation. And you mentioned just before the break X-rays. X-rays are absolutely helpful because just like a human being, if you have an opportunity to look at that spinal film, you can diagnose that X-ray, that subluxation pretty quickly on there. And you can see changes in disc height. You can see degenerative arthritis, just like we would have with us. And we were talking about hydration and how important that is. That disc in a human has a really solid core of water. And if we get dehydrated, and animals can do it too, you start to break down that outside lining of the disc. It becomes very fragile. And they're way more active sometimes in the directions they go and the speed at which they take off, especially if they're playing with other animals. It's just as easy for them to herniate a disc as it is us.
And that's what I did with Tucker right away, is got him hydrated, hooked him up to an IV. And I saw the importance right away of keeping him hydrated. And now, like, even he's off the IV, but I'm adding moisture to his food.
Right.
Because dogs really absorb most of their moisture from their food, not necessarily from drinking water.
Right.
and you can see, you know, improvement just from the hydration.
Yeah, that disc needs
it helps get the oxygen there. It helps remove the inflammation.
That's a big one. It really does. It helps to get a lot of those the chemicals that occur as a result of normal function. We feel it most easily if you work out and you get the lactic acid burn in there, but all of those things are just products of normal function, but they have to be removed. And if they're not, they really push that inflammation along and can cause more problems down the road.
I'm doing things with him besides the acupuncture and then your adjustments. I'm giving him the flexor, my joint formula, which is full of MSM and chondroitin and glucosamine and a number of other things that are oxygenators and anti-inflammatories. And we're giving, today, in fact, he's getting fish oil every day, which is important. I'm giving a little SAMe every day throughout the day. A number of these things that are all meant to reduce that inflammation, because this nerve blockage is basically damage done from inflammation.
You got it.
And in fact, today I started on giving him chlorophyll, which is another oxygenator, because that oxygen delivered there will help that healing.
Yes.
And just the improvements today, when I exercise him, I'm starting to get slight resistance now, where I didn't have any. I had this free-flowing leg, and now he's starting to give me some resistance. And if he's laying on his side, and I grab his foot that he's sleeping on, he starts to rock his feet back and forth, you know. And some of that might be reflex, but actually I think most of it isn't, because he's responding. I'm hurting him and he's pulling his leg back.
Right.
So it's a willful pull.
Yes, and if he's got the ability to not only sense deep pressure but also light touch, those are all related to the nervous system and the nerve roots coming off the spine. So if he's at least able to take that information in, we know part of that pathway is open. And 80% of our nervous system is sensory anyways. So it's important that we're getting the information in. If we're getting it in, then there's a very good chance that we're getting new signals coming back down. Because while they're not the exact same path, they are right up against each other. So if we know that that's happening, that's a good indicator.
And that's evident in the fact that before, I really had to pinch his tail to get some movement on him, and he would kind of jerk it back. Now, if I just stroke his tail, he knows right away. He looks. He tells me right away that I'm touching his tail. Why am I doing that? Without any pressure, without any pinching, without any pulling. You know, so that's a
great indicator.
Great indicator. I feel that as well.
And go ahead. I'm sorry. I didn't mean
well, I was going to ask you. You instructed me how to do a technique on his back to help that flow.
Right.
And so, what's that called, and what am I doing?
Two things. One of the first techniques we did with him, because we wanted to keep it really, really low force because there was already some inflammation there, we didn't want to add to that, is craniosacral, which is a common adjustment we do with people all the time. And craniosacral has one goal and one goal only. And if we can use this towel, I don't know if you guys will be able to see this, but this is a really easy understanding. If somebody were making their bed and there were a wrinkle on one side, instead of walking all the way around, very often we take this side and we pull it and we straighten it out. The difference between the towel and our body is, very simply, our body is filled with connective tissue, long lines of connective tissue. And if that connective tissue is very, very bunched up, then the muscles, the nerves and blood vessels that are running between it have a very difficult time getting through, not only getting the nutrients through, but also signals through there. If that connective tissue is nice and long and flexible, then not only does the body work better, but we're having better conductivity there. So craniosacral is all about making sure that the fascia or the connective tissue is balanced and there are no twists or areas that are bunched up that somebody who was doing massage might call a trigger point. It'd be similar to a trigger point in a muscle. Part of that then was the massage down the spine to really alleviate some of the resistance that's there. And we need that resistance initially because it helps that joint from becoming further aggravated. But we don't want it long term, because now we're blocking blood flow in and the joint begins to stiffen. And if it becomes chronic, then that's what leads us down that path to arthritis. So we want some light massage in there, and then the craniosacral component to that is also affecting the blood flow into that region, so we're getting the good nutrients in and we're removing those waste products.
Well, I've noticed two things, and I do it several times a day. I've had several occasions where he's had a bowel movement right after I've done that.
Very common.
And then I've had other occasions where he just lolls off to sleep.
It's incredibly relaxing because you are getting an endorphin release, which are natural painkillers, and they're also very much necessary for building of new tissue. But they do relax you. As far as the bowel movement goes, you know, it's funny. I had a guy who was bringing his daughter in on a regular basis, and she was having trouble going to the bathroom. And so that's the technique we were using because it's very effective. It's low force, and there's not a lot of force that needs to be done with any adjustment. but especially with kids, there are certain differences. And so when I adjust kids, you always modify the technique to their needs and their size. And his biggest complaint was she always had a bowel movement after. Even though that's what we were going for, he had to be the one to clean her up and do all the stuff and carry the big bag in, and it was a little bit much for him, but it works.
Well, you know, it's kind of amazing. When I basically have a disabled dog, although I know it's a temporary situation.
Right.
But the impact that on that dog to have this disability right now, this affliction, and the impact on my life as well.
Sure.
And the impact on the other dogs, it's absolutely amazing. I mean, if I leave, I try not to be gone more than an hour, and I limit the times I even leave the house.
Right.
You know,
it changes your routine.
It changes everything, and you want that dog back to wellness and health as soon as possible. And I see it happening with everything that we're doing. Of course, I'm as impatient as everybody else, sometimes even more so, and I want it done now.
Right.
You know, but I mean, I'm using things such as DMSO.
Right.
I leave a letter off of there.
No, I think you got it.
Yeah, I got them, which it helps oxygenate, and I'm putting it right on that area. You right away assessed it as a space between T1 and T2. His vet, even with an X-ray, wasn't quite sure.
Right. Actually, L1 and L2.
Oh, yeah. I
T12,
L1, yeah,
L2.
Yeah. Okay,
yes.
L1, L2, and that's the area that I'm applying. You know,
right.
the MSO, and I'm seeing this gradual every day. We're going to be 2 weeks tomorrow.
Right.
There's been not one setback day, but every day has been an improvement day.
And it's a process. Again, regardless of who we're talking about, it's a process of change, whether it be constructive or destructive. I think most often all of us, and you said the right words, is we get frustrated sometimes and we want it now, but we're talking about the changeover of damaged tissue for healthy tissue, and that's at a cellular level. So that takes a little bit of time, and the bigger the injury, the longer it takes.
Yeah.
But the fact is, it does occur, like you said, provided the right nutrition in there and the right input in that nervous system, that body will heal given the opportunity.
Yeah, and I see that. You know, I say, and we're doing everything humanly possible.
Right.
And more so.
Right.
So, you know, I see it happening. Yeah, we're gonna. You brought some props.
Yes.
I guess you can call that.
We could call it that.
I held. That's a plastic one.
That's not the real thing.
And we're going to be going to a commercial break here shortly. But we're gonna talk about this spine. This is a human spine, not a dog spine.
Exactly, but it gives us an idea of how the adjustment works and really how we're looking at it. And in this position, it's pretty easy to.
Because the dog and the human spine isn't that different.
They're very, very close. Each species may have a segment more or a segment less, or be put together slightly different, but they're really not that different, and how they function is very, very similar. Like I said earlier, the only big difference neurologically between them and us is they don't have the recurrent meningeal nerve that we do, and it's why dogs can take the level of abuse that they can before they ever become symptomatic, because they don't have the input there that if that happened to you or I, we'd know right away.
Shut it down right away.
So that's a big difference. But yeah, we'll talk about that.
Okay, I think we're going to our commercial break now, and please stay tuned. We'll be back in a few seconds or a few minutes, and you're watching Let's Talk Healthy Pets. See you in a couple moments.
In our numbers, our call is to action. To practice what we preach, be there to care. Our passion is compassion. We're only human, but together we're humane. Our letters stand for taking a stand, for taking the lead, for filling the need. The American Society for Prevention of Cruelty to Animals. Be part of our heart.
Breast cancer doesn't just affect women. This year, nearly 40,000 women will die. The Breast Cancer Research Foundation has awarded $40 million in research grants. Please help us make a difference. Visit us at bcrfcure.org or call 1-866-FIND-A-CURE.
When a baby is born, even though teeth can't be seen, all 20 primary teeth are there. Baby teeth typically begin to erupt between the ages of 6 months and 1 year. Usually the front 4 teeth are the first to appear. Teething is often painful, and many babies experience sore or tender gums. To help alleviate the pain, try rubbing the gums with a clean finger or small cold spoon. Children may begin to put objects into their mouths and bite them. If that happens, try a chilled teething ring. There are also anti-inflammatory medications for children or over-the-counter topical ointments for numbing the gums. However, if a fever develops, call your pediatrician. It's not a normal part of teething. If you have any questions regarding teething, ask your dentist. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
Welcome back. I'm Dr. Ed Sulkowski, and you're watching Let's Talk Healthy Pets. We're here with our special guest, Dr. Jonas Marry, a chiropractor in Peters Township, who not only does humans but does animals as well. And before commercial break, we were talking, and Dr. Marry was showing the model of the skeletal, whereas when I went to school, our anatomist called it the skeletal system, and we didn't know what he was talking about for the longest time.
We must have had the same instructor.
He was from England, and he kept saying...
That's exactly right.
He kept saying skeletal. We're all
Where's
looking,
that?
What's a skeletal? But in any case, the skeletal system over here, and you were demonstrating, we were talking how it's not that much different.
No, it really isn't. They have very similar spine to ours, and really, if we were looking at this in this position, all we're really doing is if we're looking straight down on their back. So the bumpy spots that you feel on your own back or your animal's spine are these little pieces here which are called the spinous processes. And I don't know if there you go, you can see it. That spinous process is just the most posterior or back part of that spine. And when we're actually evaluating, this is the area that we're evaluating first. And the way that we do this is with this instrument. It's not the only way to do an adjustment. It is one of the most common, and I found it to be one of the most effective because, as we said earlier, it gives us a read or a response that we can reproduce. It's either present or it isn't. So this, by turning the back end of this, we have the ability to set the tension to higher or lower forces. And anytime we're adjusting any animal, we're really not exceeding just a few pounds of force, or for that matter with humans.
And what do you call that instrument?
This originally, when Dr. Inman was working with the chiropractor, they were using what's called an activator. This is not an activator, but it's very similar. This is called a dual tool. And what it is, the big name for it is the spinal accelerometer.
Okay.
And all that means is that when we pull that back, this head comes down and then releases. And I don't know if we'll be able to see that, but it looks like that. And I don't know if you can see my finger moving. It's really fast, but it's a very low force. So as we put this on the spine, we're going on each of those tiny little processes and making a thrust, just like this. Now, if the animal's healthy, the effect that we're going to see is nothing. There won't be any effect. There won't be any twitch. There won't be any response. And in fact, they kind of pretty much ignore you. If something is going on, though, when you get to that area and you make that adjustment or that thrust, what you'll get is in the skin or in really the muscles just underneath the skin at this level will twitch. And the reason for that is because the nerves that are exiting the spine at that level feed that particular muscle in the skin. So when we have that force in there, that quick little thrust, if there's something going on and they can't dissipate the force, we get a response. So that tells us there's an unhealthy joint there. And as you continue down, we just go all the way down the spine until we get to the hips, and we evaluate the hips as well. Because small animals or large, and certain dogs are predisposed to hip dysplasia and certain other issues, we always evaluate last the hips and make sure that there's balance there as well, because if the hips are not even though they're not erect like we are and putting all their weight on there, they're still going to affect potentially the movement of the spine as a whole. So we always make sure we evaluate the hips last and make sure that there's balance there as well.
So what you're looking at here, these are the individual vertebrae.
Yes.
These are the nerves representing the nerves that are coming out.
Exactly.
And then this disc space is the cartilage that's in between the...
You got it. This is the disc right in between each vertebrae.
So due to injury, sometimes due to poor nutrition with age, because I'm not a firm believer that age just does this on its own. It's the lack of nutrition and so forth over time. But this space closes.
It will actually, the fibers that make up the outside layer of the disc overlap. And they do that this way, and then this way, and then this way, which produces an incredibly strong outer ring, and that's what it's called, is the annulus fibrosus, is the outer ring. It's really, really strong, but if we don't have proper hydration or poor nutrition, or we have a long-standing subluxation, then we're not getting normal movement in that joint. Those discs only get fed, and so do the cartilage, where the discs actually connect to the bones. They only get fed if there's movement. It's called imbibition. So if there's movement there, we get nutrition in and we get waste products out. A subluxation defined as a lack of movement at that particular segment. So we're either not going to have the right nutrition there and we're going to have a breakdown, or an overutilization of that area where we're just damaging the joint itself. But all those factors combined, begin the process of what most people call arthritis.
And when we talk nutrition, we're talking oxygen as well.
Critical. Because your nervous system, of all the systems in your body, your nervous system, while by weight it's one of the smallest, consumes more oxygen than any other system in the body. So I think that's pretty apparent when we talk about the people who, especially this time of year, although we're not having the weather for it, but the people who fall in cold water or without oxygen for one reason or another, whether it's a drowning situation or something else, we're most concerned about is the brain going to be able to return to function or not. So if we don't have oxygen in that nerve tissue, then we're going to have a deficit, and wherever this nerve goes, because they don't just stop here, they're going all throughout the body. In fact, if we could remove all the tissue from the body and just leave the nerves, you would still be able to recognize it as a human form. It's so extensive. So if this is going to your leg, then maybe a little bit of weakness in the leg. If you're not a world-class sprinter and it's very, very mild, you're not really going to notice. But those nerves also go to organs.
Well, what's interesting, too, is wherever there's a nerve, there's a blood vessel.
Exactly. And we can't carry that. We can't get the nutrients there, we can't get the oxygen there, and we can't get the waste products out. And you're exactly right, it's critical, and that's all throughout the body that's the case.
And when I've talked to so many people about the importance of nutrition for themselves as well as their animals, and we talk about things like glucosamine and chondroitin and hyaluronic acid, which your body makes.
Right.
And those are things that help put that synovial fluid in there, which is the buffer and basically the lubricant of all of this.
You know what? It's one of my favorite tidbits of information, and it's probably one of the only little bits of information I retained from physics. But if you have a normal, healthy joint, your coefficient of friction, in other words, how easily one moves across the other, and all your joints work like this if they're healthy, is less than that of ice on ice. So you think about how slippery ice is just all by itself, but two pieces of ice gliding across each other don't move near as easily as two healthy joints do. But when you talk about damage to that joint for any of the reasons that we mentioned, then we begin to lose this. And that loss of joint motion affects the nerves, it affects the joints, and it affects blood flow into that area.
The original activator, I think you told me one time, was designed by a dentist.
It was a dental tool, and we're probably going to scare a few people with this. It did not have this soft rubber tip on the end. What it actually had was what looked like a flathead screwdriver. It was a wedge. And they used it on a tooth to break it, to crack that tooth if there was having a very difficult time extracting it. And if they couldn't get that tooth out as it was, it would go in, it would split that tooth in half, and it would make it easier to bring the pieces out, which doesn't sound pleasant to me. I bet you never used that.
Actually, no. I have used a hammer and an instrument to take a crown off, which seemed kind of archaic, but it worked really well. Maybe I needed that.
Maybe this would be effective. You know what I really like about this is the fact that it is objective. Palpating the spine is effective. It's easy to feel the changes in there if that's your training. It's very, very simple to notice those differences. And it's very obvious when you're lacking joint motion in any one of those segments. But the nice thing about the instrument is it gives us the ability to put motion into that area and see it not only in a static format, not just doing this, but when we have motion there, how's it respond? Because I can't tell you the number of times that I've evaluated somebody. We have specialized tables to do this with people. But you palpate them in a static manner and you feel the differences, but then you put a little bit of motion in there and it's night and day difference, and it's a lot more diagnostic that way. You can say, yeah, that for sure is the area, and it's consistent with the injury that we're seeing today.
Well, regarding Tucker, when I brought him in and you looked at him and then you put your hands down his back, and right away you said it's this, it's up, move, rotated up to the left, I think you said,
yes.
Is what you said, and you knew that instantly just by placing your hands and feeling where these vertebrae were misaligned.
There's 6 ranges of motion to every single segment. There's a forward range, a backward range, there's a rotation left, right, and there's a side bending, especially in your low back, because you have to be able to do this movement. For him, he had a rotation right up in this region that was not only stuck back a little bit, but was twisted open, and we call that wedging. So he was rotated a bit out to the side, and I don't know if you're going to be able to pick that up. It's a really slight motion. And people have a very, there's a very common belief out there that bones pop out, especially when you see the chiropractor, that you've popped something out and they're going to pop it back. And never ever is that the case. Your joint surfaces always stay intact, but they may not be moving in each one of those 6 ranges of motion. So for him, not only was he back and turned, but he was also wedged open on that side. And that's one of the worst ways to have that wedging position, because it really creates a lot of pressure on that nerve root.
And when that happened at the office, not your office, but at the vet's office,
Right.
his response was absolutely painful.
It is very painful.
To the point where he grabbed a hold of my sleeve and started to bite my sleeve.
Yeah.
From pain.
It's
and,
very painful.
You know, he's not, after his adjustment, is not in that pain threshold anymore.
No, unfortunately, we're able to do the craniosacral that we talked about earlier, which is just
cranial is the head and sacral is the tail.
You got
basically.
It is exactly that. So we're talking about how this connection occurs from not only the top, but also all the way down to the bottom. And because that fascia that we were talking about earlier runs in uninterrupted sheets from the very top all the way down to your feet, really, you can utilize that fact and make a very, I wouldn't even say low force adjustment, because there's no force to it. It's a contact. But there's, in the craniosacral world, there's called what's called an unwinding. So from that tissue being in that tense state, we've all felt that. It's a very soft opening.
Yeah.
And it's relaxing. And sometimes that's the most important thing you can do before you ever even move to this, as low force as this activator is.
You have to use that on him, so,
yeah.
And that's what you've been doing. Well, with the time remaining in the show, we have our little patient here, Abby, who's kind enough to come and volunteer. She had no choice in the matter.
We'll check
Abby. So I've got the permission from the vet. I've called the office who made the appointment.
Right.
And I now come in with my dog, and you're seeing Abby for the first time.
Absolutely.
Which I think is the case. You haven't adjusted her yet.
True. That is true.
So there's Ab, who wonders, what am I doing here?
That's
Hi,
what she's
Ab.
thinking.
She's been a great girl so far. Hi, Abby.
And all I would do is first, we want to evaluate and just check by hand and evaluate the spine in general. Well, now we know that Abby's in pretty good shape and that you've put her back together pretty darn well. There's no change or asymmetry in her muscles. In other words, she doesn't have a great deal of spasticity on one side versus the other. She's pretty good tone all the way down. And she has what I think is probably something going on right here. But what the activator will give us the ability to do is to evaluate that and see. So we turn it down because she's a smaller dog. And this is almost about the force that I would use to adjust a rabbit. Not a lot of force is necessary. And we come right down the spine. You know, before I do this, just so people have an understanding, if we're off the body and we're clicking, there's no twitch response, because people always say to me, well, how do you know they're not just being scared by that noise? Very simply, we're doing this and we're seeing no twitch response in the body. So as we come down through, we get that, and we're seeing a bit of a twitch there, and we're seeing her legs shift just a bit, and that's the response that we're talking about. And there it is. And not so much down here. So pretty much right through the mid-thoracics, which is common for this kind of dog because they have such a long spine.
And she's a jumper. As much as I try to keep her from doing it, she's up on the couch and down off the couch.
And the ups are not so bad, it's the downs, because as they come down, they put all that weight on their shoulders and their front paws, and it tends to sometimes just jam them a little bit here. So since we know that's the area, that's where we come back. And right away I'm seeing less response. And there's one last pass, that's the third pass. And that's it, and she's clear. And so what we should see is a diminishing of that response as those segments begin to fire again. And it's exactly what happened with her. She's pretty textbook. Thank you, Abby. That was as good as we were going to get that.
Now, she has been adjusted once or twice before at the vet, but would she need another adjustment soon?
No, the protocol, at least as far as the VOM technique goes, is at least a week in between. And I think that's probably the biggest difference between animals and humans, whereas with a human, I would probably be more likely to see them back sooner. Since nothing's popping out and we're not popping it back, it's a process of change in there. It's that changeover of unhealthy cells for healthy cells. And so the repetition is important. That's why the chiropractic adjustments are repetitious. But with an animal, and because their nervous system is a little bit different than ours, we give them at least a week in between. Now, if she were really acute, if she had been hit by a car or had something serious going on that was still something we could adjust, then we would see her much more frequently because her need is greater. But right now we know overall she has good health. you've taken really good care of her, and that her spine responded really quickly, even just here, and those reads diminished quickly. So I wouldn't see her for at least a week, and I can't imagine adjusting her more than 2 or 3 times total at this point.
So on average, I have a healthy dog that I'm doing a maintenance at Chiropractic Care, I guess is the best term for it.
Sure.
Is that what you call it?
I don't use the word maintenance.
Because I think cars.
I don't use the word maintenance, but yeah, it's a fine way to understand it. And for those dogs that are, or any animal that's in pretty good shape, I don't see them more than once a month.
Better term, preventative.
I like preventative much better.
Okay, I mean,
it's easier.
Same way we do prophy, cleaning of your teeth. It's a preventative measure.
Exactly. It's
basically,
easier to keep them well than fix it if
basically,
they're
it's maintenance.
You're right. It's words.
But so you would say doing this how often to your dog?
I wouldn't do it more than once a month. Now, if I were noticing that there was an illness or there was some change in their health status, then I might look at them more closely. My daughter happens to have a cat. I check that cat once now, and she's in good shape, and I haven't checked her in probably 3 months. But her overall health is really good. And, you know, being that it's in our house, I have the ability to, even when I'm petting her and you know, she's around, she's getting evaluated. But overall health is really good, so more than once a month really isn't necessary.
Well, since you showed me cranial sacral, I've been cranial sacral
You
all the dogs.
You should. Absolutely.
You know, and they all seem to love it. It's kind of amazing. They all tune into it and get really relaxed, and it's actually kind of relaxing for me at the same time.
It is. It's very, very effective, and it is relaxing. And because we're producing those endorphins and enkephalins, with any adjustment, that one or the craniosacral, it doesn't matter if there's low force or no force, there's healing occurring, and it relaxes you.
Let's talk about some of the things that around the house that could cause injury. And we're going to run out of time here, so we're going to do this quickly. Running up and down stairs, jumping off of couches or beds.
That's the big one. Long
toenails that aren't trimmed.
Yes.
Throw the gate off a little bit.
Yes, absolutely will.
Okay.
Absolutely will. But it's the jumping down that gets them most, especially a dog that's smaller like this, because they don't have near the shock absorbing capability that a larger dog does, even though there's more force coming down in a larger dog. But the short legs make that very difficult, and that's a long jump for them, especially at that angle.
Again, nutrition is extremely important.
It's critical.
Hydration, no chlorine or fluoride in the water.
It's critical.
So
those are all the right ingredients for just a healthy person and a healthy family and a healthy dog.
Well, I want to thank you, Jonas, for coming.
Thank you.
And hope to have you back again. I know
appreciate it.
The audience appreciates this information being delivered to them, because it's something you don't hear all the time, and it's so crucial.
Fun.
So thanks again, and I want to thank Abby for being such a good patient and a good girl. We'll see you next time on Let's Talk Healthy Pets, and remember, we're always thinking positive. A healthy pet is a healthy pet.